Are you ready to reopen our city?
This will be the turning of a dial, not the flip of a switch.
We push aside our regular reporter roundtable to bring you the decision makers. While Mayor Quinton Lucas says he's not ready to end the shutdown quite yet, big parts of the metro are opening back up starting Monday. What will that look like? Will you get to return to your favorite local restaurant, swimming pool or gym? We convene 4 elected leaders from around our metro with very different views on what should happen next.
Week in Review is made possible through the generous support of Dave and Jamie Cummings, Bob and Marlise Gorley, Smithfield Foods, Haas and Wilkerson Insurance, the Courtney S. Turner Charitable Trust, John H. Mize and Bank of America N.A. co-trustees, and by viewers like you. Thank you.
Welcome everyone, I'm Nick Haynes, glad to have you with us. You know, I'm paid for a living to keep track of the news all around our metro, but I have to say, has it ever been more confusing? When do things reopen where I live? How many people am I allowed to bring into my business? And do I really have to write down the name and phone number of every customer? If you're confused, frustrated, befuddled, this half hour is for you, and quite frankly for me too, as we try to make sense together of what has become a remarkably puzzling patchwork of rules and dates in our quest to return to some sense of normalcy in our metro. Kansas City Mayor Quinton Lucas is with us. So is the Mayor of Wyandotte County, David Alvey. From Clay County, the Mayor of Gladstone, Carol Suter, joins us. And we have one of the top decision makers in Johnson County joining us on our digital video wall, Johnson County Commission Vice Chair Mike Brown. Mayor Lucas, can we start with you? I noticed that when Governor Mike Parson this week said we're reopening the state come Monday, you said this ain't the time to do that. You expressed concern he was being influenced by the protesters. You were sticking with your May 15th reopening date. Now you seem to have changed that.
As part of our SMART process and how we open or how we reopen, we also are having what we call a soft reopening, a soft opening. What that includes is the fact that there will be a number of businesses that are allowed to reopen prior to our May 15th date. And indeed, that can open 1 week from now.
Any business that doesn't draw the general public, like an ad agency or a law firm, can reopen as long as they abide by social distancing rules. What changed? Have you been listening to the protesters as well?
I try not to. I mean, I listen to all my constituents as much as possible, but I think when I say this ain't the way, you have to actually promulgate good guidance for opening. What you can't do is just tell everybody, hey, we're open for business, good luck and figure it out, businesses and individuals. And I think what we have done in Kansas City is to give fairly specific and quite stringent guidelines on the steps that it'll take to reopen businesses, not only next week, but on May the 15th. That includes our 10% capacity rules. That includes keeping track of who's coming in and people are sitting down and eating. And again, that's not Big Brother. That's more related to the fact that we want to be able to trace. So I think it's very different to say how you're reopening versus just that you're reopening and we'll make the rules later.
What do you say to those businesses who have looked at that 10-10 plan where you have to have 10 people or 10% capacity, and if they're there for over 10 minutes, you have to take their name and telephone number, that they say, we can't make money that way. If we have 50 tables in our restaurant and we can only fill 5, and you're also asking us to be the doorman and police officer at the same time.
So a few different things we say to it. First of all, if you are not ready to open yet under public health guidance, then much like how we have an existing order now, that many of these establishments aren't open, they may not be open on a later date. We understand that that is the public health trade-off that we're working with right now. In terms of how do you keep track, I mean, a number of restaurants already take reservations. Many folks, not myself, but many others, make appointments to get their hair done. Right? This is the sort of thing that we would have. And in the same way that public health officials already, if there's an outbreak at a restaurant or an elementary school, go through the steps to advise everyone who could have been exposed that there was an exposure. This is the sort of step we're trying to take. I think it's very responsible and really a prudent way to make sure we're addressing the public health need, not just now, but in the future.
But you're not telling people at Target at Ward Parkway in your city or at Home Depot in Midtown in your city right now that they have to take down every single person's customer name and phone number.
Yeah, I think very realistically, someone who sits at a table for an hour and 20 minutes is far more likely to, leave some remnants of their presence there, to have been exposed either to what happened there with a waiter or a waitress, and frankly, does need to have in some way that connectivity so that we know what happened later on. Someone who is actually just walking through the aisles fairly quickly, both as a practical matter, but even beyond that, is much harder to trace and much less likely to be infected.
Below you on our digital screen is Commissioner Mike Brown over in Johnson County. You won't find perhaps a more vocal advocate in this community of elected leaders to get businesses opening as fast as possible. Yet the governor has announced we can open businesses starting on Monday, yet Johnson County is going to be delaying for another week. What changed? Why?
Well, it's good to be with you, Nick. And so here's where we are with the data and the outcry. Really, there are two components to this. We're using data points to decide when is a scientifically and data-driven point that it's better to open, that there's a downward trend in data. And clearly, there is an upward pressure from our citizens and from our businesses to get open. The data that they're looking at seems so small in comparison to a 600,000 person population that we have in Johnson County, Kansas, that non-scientists, just your regular mom and pop business, are looking at scientific data and drawing conclusions about that in a downward trend that says we need to get open. And I agree with them. It's time to get our economy open, responsibly open.
So why delay?
That is not a decision that I'm making. As far as I can tell, it's not a decision that I will get to vote on, and I'm disappointed by that. I think a doctor should be in the equation, but I think the elected should be making the decisions on the part of the citizens of our county.
Let's move on to Wyandotte County, which has really been the hardest hit community in our entire metropolitan area. In fact, even in Kansas, almost 43% of the deaths or more coming just from your county, among your citizens and residents, David Alvey. Why didn't you join with Mayor Lucas and keeping with that May 15th date?
Yeah, there are a couple of factors that came into play with that. The first was that in all of this, we have allowed our medical team, our medical officer, Chief Medical Officer Alan, Dr. Greiner, and the team at KU to really give to us the recommendations. They're the ones who ought to be in the lead. So I would disagree with Commissioner. This is really not a political decision. This is a public health decision. The decision that the elected leaders need to make is to support and empower the public health officials to gather the data, gather the research, and make recommendations about what is necessary to protect public safety. If we were in a situation of war, we would simply defer to the military commanders to tell us what we could and what we could not do. And so I think this is really important for us to understand. That's kind of where we are. That the most important issue, the fundamental in all this, is the virus and what the virus is and what it will do. And the people best situated to monitor that and to give recommendations is our public health people. Having said that, we did not go with May 15th because Dr. Greiner, we had more time because of Governor Kelly's order till May 3rd to continue to gather evidence and to come up with the right ways to reopen. And so we wanted to make use of that time. And I also did not want to communicate to folks that May 15th is a drop dead date. My concern is when we come out with dates, and they're necessary in many ways, but when you come with a date, there is a certain amount of public confidence in that date. And we want to make sure that Dr. Greiner wanted to make sure that that date was going to be appropriate and necessary.
Okay.
And so,
all right. Let me
Governor Kelly.
Okay, let me bring in here from Clay County, the mayor of Gladstone, Carol Souter, and you're in a county that is opening up on Monday. Does that mean we get to go to our favorite restaurants in your community, bars? We get to go to the hair salon on Monday?
Yes, it does actually, but with restrictions. In Clay County, I think we've taken what I keep telling people is a simple approach, probably simpler than almost all the jurisdictions around. But I have to chuckle because our county health director's order is actually 13 pages long. But we've been working in Clay County probably more cooperatively between electeds and our medical advisor. So he has kept us apprised at every step of what the data shows and what he's thinking about implementing. And that has allowed elected officials to kind of work with him and be able to plan ahead a little bit better. We've that idea of picking a date and sticking with it is really helpful to the community to have confidence and to help people to plan. This is a crazy environment for businesses. I don't know how they're managing in this totally bizarre environment that we have right now.
But there seems to be completely different restrictions on each different area of our community. I see in Platte County, for instance, a restaurant can open as long as the tables are 6 feet apart. We heard the mayor talk about the 10% rule, only 10% capacity. I think Johnson County was considering a 50% capacity or a 25% capacity. Are we leading to total mass confusion here?
Absolutely. When we went into the shutdowns, it was easy because their medical opinion was unanimous. Everybody agreed we have to shut down. Ever since then, we're reacting to each of our individual jurisdictions' data. And we have different experiences with this epidemic in different parts of the region. So we knew coming out was going to be more challenging. And I would hope, I mean, we all would have hoped that as a region we could kind of coordinate, but I'd say we've pretty much ended up right now hearing that we have dates from, the 3rd, the 6th, the 9th, the
Yes.
11th, the 15th, that we've created total chaos.
Absolutely. And Mayor Lucas, back in March, everybody was with you at Union Station. I saw all of those county leaders behind you, all supporting in one voice the extension of the having a stay-at-home order. What broke down?
I think we'll have time for study about that sometime after. Mayor Suter is correct that there are different data points in every jurisdiction. But, if there is a critique that I think is a very fair one, it is that we are one community. I think while myself and David Alvey and Carol and Mike may represent different jurisdictions, literally all of our people cross lines of all those jurisdictions, particularly mine and Carol's, all the time. And so I would hope that as we go forward, and perhaps this would be the politicians, myself included, taking a back seat over time, I would hope that we can get back to a point where the medical officials can be in some unanimity for saying how we address these issues in our area. But I will say this, and I've noted it a few times, and I think Commissioner Brown, and I mean it with respect, in some ways represented that position, which is that there became a different kind of public sentiment at issue. Back in March, I think there was a reality that almost everyone was incredibly afraid of what was going on. We're hearing more conversation about the economy. We're hearing more conversation about what this means more broadly. I won't speak to my views. You can read about them anywhere. But nevertheless, I think that became part of the conversation. And we're seeing that difference in the number of different communities in no small part based on that.
What happens, though, Mike Brown, if in Johnson County, because you open, that there are more deaths and uptick in cases, do you then shut down the entire county again? Or do you say if it happened at a barbershop or a specific restaurant, you just close that place down?
So here's what the right now, as I see it, the plan for Johnson County, Kansas is we'll be watching the data carefully. And as we watch the data and we see upticks in hospital utilization, infection rate, IC usage, ventilator usage, and or up to and including deaths, if any of those numbers begin to trend up in a significant fashion, then it is time to pull back on the reins and woe it down some. If we've opened up to a level that allows for the infection rate to then take off, that's the responsible thing to do as the government, as the entity watching this. I believe we need to get open, but I also believe that we need to keep an eye on this.
I should point out that a lot of area businesses are also going to some remarkable efforts to prepare to make sure when they open, they're keeping customers safe. Our friends at 41 Action News has been looking at what restaurants are doing. The manager of Charlie Hooper's in Brookside was interviewed, and he had for me at least a shockingly long list of changes they were now making.
The entire dining room is going to change. We'll have tables spaced out more, whereas before you kind of crammed them in. We'll have plexiglass between booths. We'll have no condiments on the table. Everything's going to be single use. You may not get a menu. You may have to look it up on your phone.
And then there's the big box stores, Costco on both sides of state lines, saying starting on Monday, all shoppers will have to wear a mask or a face covering, or they will not be able to come into the store. I know that's not sitting well with some of their customers.
I'm not coming if I wear a mask.
I don't think it's right. That's my opinion, but I know that you got to protect everyone around that are sick and elderly like myself, that have immune system problems. They might have it, but this thing is dying down, so I just don't think it's right.
Every single customer going into the store has to have a facial covering, has to have a face mask. Is that what they're doing individually, or do any of your own plans require citizens to now wear face masks when they go to restaurants or businesses? Mayor Suter?
Our health directive requires, if you can use required, there's no real authority for the health director to enforce any of this. And unless any of us as cities create ordinances, with penalties, there's not really a way to enforce it. But the strong recommendation is that everyone wear a face covering outside, that businesses are required to have all their employees have faces covered, and are encouraged again to kind of set their own rules. As I keep telling business owners, if you want to make sure customers are covered, put a sign on the door that says no admission without a mask. Businesses have a lot of control over what happens inside, and they need to exercise responsibility.
Mayor Lucas, I did see in your plan, though, if you're in contact with customers, say you're in a barber shop or a beauty salon, the employer has to provide face mask, and also for the customer as well?
Yes. I mean, perhaps we have a different number of employees of regulated industries in the health department in Kansas City versus Gladstone, but we do plan to enforce our orders. We'll use the health department to follow up with folks, to visit where there is non-compliance, and to ultimately issue fines if necessary where they're not being followed regularly.
I see in Johnson County, Mike Brown, that there are already police departments saying we're annoyed by how many calls we're now getting. It's becoming out of control. People complaining about neighbors in their backyard, the social distancing. They have to police these communities after all of this, and they need to gain that trust. Are you concerned about the enforcement aspects of this?
I couldn't be more concerned about the prospect of the police involved in enforcing this order. This needs to be a self-policed, community-activated, individual obligation to limit the spread of this disease, and it is critically important, at least to me, on the Johnson County side, that our police officers are not in the position of walking into businesses, homes, and people's private property and making sure that they are compliant. To me, that creates a flashpoint that is somewhere between someone with a badge and a gun doing their job and giving an order against somebody who possibly has an interest. It feels like maybe their rights have been stepped on, and and at that point you could create a flashpoint.
Mayor Alvey, some of these plans now run page after page after page. They're difficult to decipher. Is it going to be hard to enforce any of these rules when it comes to Wyandotte County?
Well, I think, again, I'm going to drive it right back down to the fundamentals, which is the virus. And I encourage all of our residents, all of our businesses to read about the virus, what it does, how it progresses. Let the medical community guide us in this. But what I hear from folks all over the place is do not reopen, do not give us any guidelines unless it is going to be for our safety. And so the vast majority of people, even though they do want to get back to normal, and I as well want to get back to normal, that's not going to happen because of what the virus is and how it moves. And so the personal responsibility here is perhaps the one of the greatest values Americans hold is that personal responsibility, that personal freedom, and that we have to understand that if I go someplace and I am not washing my hands, if I am not wearing a mask, I have a responsibility to my family not to bring the virus back. I have a responsibility as a business owner not to expose my customers or clients to that. I have a responsibility to my employers, my employees. And what I keep hearing from people is the caution overrides the desire to reopen.
Okay, the only person on this show right now where people can start going to restaurants on Monday is in Gladstone. That's in Clay County, and Platte County is also doing that, and Cass County in our area. What about some of the other things we want to be able to do, like go to a swimming pool?
Clay County, it's Monday.
Okay.
With the restriction for attendance of, I think, 25 people or 25% of the pool's capacity. But the truth is, a public pool like Gladstone's, we can't afford to open a public pool for 25% capacity, so we won't.
Well, in Independence, Missouri, I see they've actually just shut down this pools and said, we'll see you next year. What about in Kansas City, Missouri, Quinton Lucas?
You know, one thing I agree greatly with Mayor Alvey on is that we need to let the science and the virus dictate. At this point, we have no plan for when the pools will be reopened. We do not yet know when our large events will be reopened. I mean, there's an important balance. I won't go too long on it, but we need to give people deadlines or timelines. But we also need to say that with those timelines, it still is dependent on the medical data. And so that's where we'll be on pools. That's where we'll be on everything in the future in Kansas City.
Including things like in-person graduations, which school districts all around our metro are now claiming they're going to do in July. There's talk of going back to school in the fall. Are you not certain about that still, Mayor Lucas?
not certain about, I hate to say it this way, but I'm not certain about anything, right? I'm a lawyer, not a medical doctor. And so we'll listen to that advice as time goes on.
Do you have a better sense of what would happen in Johnson County on those questions, Mike Brown?
Well, when it comes to your question about swimming pools and venues, public venues like that, I included in a list on an email served last night that I was reading that the city of Olathe is planning now and accepting registrations for swim lessons, I believe, in swim teams. So our individual cities will make the best decision that's best for them under the guidance of the phased plan. And I trust and respect the leaders in those communities to make the best decision for their community.
And you have a lot of assets, of course, in Wyandotte County, David Alvey, and that includes the big speedway. You've got a casino, you've got the Legends. I mean, lots of different venues there that big public groups come to, which you're not making any money on right now because they're shut down. What is the biggest thing that keeps you up at night thinking about your community at this point in time?
Well, I mean, clearly, I've known people who have suffered from the virus, people who have lost loved ones to the virus. So that's my greatest concern. Every day, I'm sure other mayors and Commissioner Brown as well receive emails from people who are struggling financially. And so those are what, they don't keep me up at night. It's what I take to prayer. But I will say this, I have to say I'm very proud and I'm grateful for the professional community, business leaders, our community leaders, our school leaders, and people across the county who have really taken this seriously and really want to do what is best for all. And so that is encouraging to me. And I don't think that should be lost in this discussion, even though this is a crisis and there's a challenge. The way people have stepped forward and really come together to try and do what is best for the common good is truly encouraging to me.
What about you, Mayor Lucas? What keeps you up at night at this point?
It all relates to the virus. It all relates to the disproportionate impact we see the virus doing in certain communities, certainly in my city and David's community. I think that is the thing that depresses me the most. And I'll tell you this, what's kept me up at night over the past week and weeks is that as we've talked about the reopening conversation, the reality that might lead to more infections and it might lead to more lives lost. That is a very difficult and tough position. And that's why our medical advice is vital in connection with what we do.
Yeah, so in Gladstone then, Carol Suter, is that your concern now that you're reopening on Monday, that you will see that uptick in cases? You will see potentially more deaths?
Well, we certainly expect that with more contact, there could be a slight uptick, and that's pretty much our expectation. The whole point of this shutdown has been to prevent overwhelming the healthcare system. We're not anywhere near, going to overtake our healthcare system. So we're quite comfortable that even with a significant uptick, the healthcare system can manage. What's keeping me awake more at night right now is I think the rollout is going to happen pretty naturally. Some people are real eager, some people are so scared they're not going to come out of their houses for months. Most people want to move forward, but cautious. And I think that's going to be the watchword. We're all going to just find our way and things will get back to normal over the next months. What worries me is the recession, probably depression that this economy is coming out of, and the long-term effect that is going to have on all of our cities and counties and local governments' ability to serve our citizens.
And they already have. I see in Johnson County, the city of Olathe has almost furloughed almost every single member of their city staff. Johnson County furloughing hundreds of staff in your county government there. Mike Brown, what keeps you up at night at this point in time?
So let's run through the list that makes me wake up at 1:30 in the morning and stare at the ceiling. Very much agree with Mayor Suter on her points, making sure that our hospitals stay under control and managed and we hold ourselves at a level that's manageable, that we don't wind up in a position similar to some of the bigger cities in America that just suffered. We've all watched on TV and on the news. That is critically important, and that does keep me up at night. It also, what keeps me up at night is thinking about the people in the Johnson Countyans and the Americans that have lost their lives in this. What else keeps me up at night is the small business owner who calls me pleading in an email, please open my business. If I'm not open in 3 days, I'm bankrupt. I will have to call an attorney and I'm out of business. They've securitized their business with a loan that is guaranteed by everything they own. And they are going into personal bankruptcy and being caused by an external event that they had nothing to do with. That keeps me awake at night.
It's great to see all of these community leaders coming together on the same digital screen with us in this program. But I was wondering, Mayor Lucas, are you having fewer conversations with your fellow mayors and fellow county leaders since that story broke about a New York Times reporter being on one of your confidential private calls with mayors this past week?
City leaders and health officials say they were shocked to learn a private meeting they had about the coronavirus is now blown wide open in the New York Times.
Little did they know on the other end of that phone line was also a New York Times reporter. According to the article, the reporter was invited to listen in by a person on the call.
I do wonder who felt the need to divulge that conversation.
Yeah, has that now led to fewer calls, fewer communications with your fellow mayors and county leaders as a result of that breakdown in trust?
I would think that any time that you have something like that, it can lead folks to be more cautious with what they're saying. But here's the thing: we've got big boy and big girl jobs, and I need to continue to talk to David Alvey as necessary, and Carol Suter, who I actually did talk to just this weekend, and so many others. So we're going to continue to do our jobs, no matter what the New York Times, no matter what any publication does, because it's important for the people of Kansas City and our entire region long term.
Mayor Lucas, Carol Suter, the mayor of Gladstone, David Alvey, the mayor of Wyandotte County, and vice chair of the Johnson County Commission, Mike Brown, thank you so much for being with us on this decision maker edition of Kansas City Week in Review. I'm Nick Haynes. From all of us here at KCPT, keep calm and carry on.
Week in Review is made possible through the generous support of Dave and Jamie Cummings, Bob and Marlise Gorley, Smithfield Foods, Haas and Wilkerson Insurance, the Courtney S. Turner Charitable Trust, John H. Mize and Bank of America N.A. co-trustees, and by viewers like you. Thank you.